Prepare to have your health questions answered here on Safe, Effective Natural Solutions with Dr. Todd Binkley, owner of Binkley Healing Center in downtown Ventura. Now, here's Dr. Todd.
Good afternoon. I'm Dr. Todd Binkley, board-certified doctor of non-force chiropractic and practitioner of functional medicine. The purpose of this show is to arm you with useful, relevant, research-based information that you can use to take better care of your health. If you've been to several doctors and you have something that doesn't feel right and you've been told that there's nothing wrong with you, that's obviously not true. If you don't feel right, something is wrong. You just haven't identified it yet. And it can be really frustrating. You can go to several doctors and run a bunch of tests. And it always seems like if you go to a licensed practitioner that they're going to check everything, that they're going to do the best they can to identify what's wrong with you. And unfortunately, the reason that breaks down is because the practice of medicine is identifying disease that you have that requires medical care. Medical doctors are busy. They're treating people who have disease that require medical care. They do not check to see if you're healthy. They do not check to see if you have some deficiencies in several organs and systems in your body that just need a little bit of support. Functional medicine means using the same standard diagnostic tests to identify earlier signs of a little bit of stress, a little bit of places where your kidneys, your liver, your immune system, your digestive system, your gut microbiome, your thyroid might need a little bit of support. And when you check everything and see if everything is working 100% or not, and give it the support, give your body the support, your river of life, your bloodstream, all the nutrients the cells throughout your body need to heal and repair themselves, then magic happens, or it often seems to people like a miracle of some sorts has occurred because they just don't know how to explain it. But that's normal human physiology. Feels magical when it works, and it feels awful when it doesn't. And you can find out the difference in the situation that you're in or someone you love by doing the proper testing and getting an analysis that's a little bit more progressive to identify ways that you can support your body's natural healing mechanism. So one of the most common things that people show up in my office for, and frankly most functional medicine practitioners throughout the country, is fatigue, low energy. You don't feel like yourself anymore. A couple years ago, you were doing the same things you're doing now, working the same job, sleeping the same amount of sleep, exercising, eating the same food, but something has changed. What's the difference? Well, there are 12. I'm doing a series, the past three or four episodes. I've been going through a series of the 12 that I've identified that I always like to explain to people are the 12 most commonly overlooked causes of fatigue. There's lots more, but there are 12 that are the most common. So there's lots of other causes of fatigue. I might get into some of those too, but the point is overlooked. So many of these things are just not tested for routinely. So in the past 3 or 4 episodes, I've gone over insufficient protein. If you have insufficient protein, your body lacks the basic fundamental nutrient it needs to heal and repair every cell in your body. Most people are aware of the importance of, more and more people are aware of the importance of eating protein, but even if you eat adequate amounts of protein, you can still be deficient in it. What? Yeah, let me say that again. You can be eating plenty of protein and still be deficient in protein. The only way you'll know that is if you do a blood test to identify your protein levels. So lots of people lack the enzymes and the acid in their stomach that you need to digest the protein that you're eating. So lots of people that have no idea that they don't have sufficient protein, even though they're eating it, because they lack the enzymes and other acid and things that your body needs to assimilate the protein that you're eating. Chronic subclinical infections is another very common cause of overlooked cause of fatigue. Not a full-blown acute infection that requires antibiotics, but a low-grade virus, bacteria, usually in the gut, sometimes in the sinuses, sometimes in the teeth. It can be other places. The gut's the most common place. Too many bad bacteria, not enough good bacteria, throwing you out of balance. That creates a strain on your immune system. How often is that? When you have something like that, chronic means it's been there for a long time, and it means that it's affecting your body 24/7, 365. So it's a mild strain. It's something you won't notice. You don't think you're sick. You don't think you have a flu or a virus or a bug or anything because you don't have a fever or the aches and pains and stuffy nose and the signs that you get when you have an acute, which means recent infection, when you have a chronic, which means long-term, persisting over time, infection that's subclinical below the standard numbers that show up on tests to say, okay, you need antibiotics. No, if it's flying below the radar, you have a bug in your system that your body's never been able to completely fight off, your immune system needs support. When it doesn't get that support, often the only symptom you have is fatigue. Hypothyroidism, subclinical. Again, subclinical means doesn't show up on a standard medical test. They're only looking for full-blown disease. So a lot of people, especially women over 50, millions and millions of women are told their thyroid's fine. They suspect. Other people say, oh, it sounds like you have hypothyroidism. You have cold hands and feet, weight gains, difficult to lose, dry skin, hair loss, low energy is the biggest one. And you go to the doctor and they say, oh, your thyroid's fine. We did your TSH. It's fine. No worry about it. Well, that's not true. You have to do more tests to identify true hypothyroidism that flies under the radar, and lots of, especially women, but some men also have functional hypothyroidism. Your thyroid is not working optimally like it used to work in your 20s and 30s, and just one or two supplements often is sufficient to fix that before you end up on medication like levothyroxine or Synthroid for the rest of your life. Prediabetes is a very common cause of low energy. When you eat too much starch and sugar, it creates a spike and then a trough. So your blood sugar spikes and then it drops down too low, and your pancreas starts pumping out too much insulin to respond to a bunch of starch and sugar that you're eating and then not exercising to burn off. That causes low blood sugar. So the bottom line, the easiest way to remember this is eating too much starch and sugar causes low blood sugar. It causes the effects and the fatigue of low blood sugar because of that spike and that quick drop. Insulin spikes, that causes your blood sugar to go down and causes fatigue. Really easy to diagnose that. Another common one is dehydration. We talked about this, not drinking enough water. Puts a strain on your kidneys, puts a strain on your liver. It creates irritation in your joints, which makes it difficult to move and difficult to exercise, and for a whole host of other reasons. Just not drinking enough water causes fatigue. It makes it difficult for your brain to function properly. If you've ever heard of the sundowning phenomenon, if you have family members that have Alzheimer's, you may have heard that, oh, they were fine yesterday morning. They wake up in the morning, they're alert, they can remember your name, they remember lots of things, and then by the time the evening rolls around, they're no good anymore. Well, a lot of times that not only this, but a lot of times a big part of that is simply dehydration. People who do not drink enough water. The water they have drank distributes itself throughout your body as best it can when you're lying down and when you're sleeping, and you wake up in the morning and things are working pretty good. And then once you go throughout your day, the effects of the dehydration take hold. The water is more important to keep your blood pressure up, to keep your heart, your kidneys, and your liver functioning, and your brain suffering even a slight loss of blood pressure or sufficient fluid to provide nutrients to your brain makes you experience more of the symptoms of dementia that are just, one step away of coming and going. So we're mostly talking about fatigue. Here's the next big cause, commonly overlooked cause of fatigue: iron deficiency anemia. So before we get into that, I'm Dr. Todd Binkley. You're listening to safe, effective, natural solutions to almost any health challenge. Iron deficiency anemia is something probably most of you have heard of. Everyone knows that most people know that iron is required to make red blood cells, the little donut-shaped oxygen-carrying cells that are made in your bone marrow and circulate throughout your body to provide oxygen to all your cells. Your body has over a dozen different mechanisms to make sure that you're getting adequate oxygen to all of your cells, and slight drop in the available oxygen to various parts of your body will create immediate changes in your blood pressure, in your heart rate, in your bone marrow's attempts to make adequate more red blood cells to keep up with the demand. Having oxygen available to every part of your body is one of the most critical things for sustaining life. And so your body is very adept at sensing ongoingly, 24/7, any change in that, any reduction in that. So it has a number of mechanisms to deal with any interference in that. So the brain is the most sensitive organ to any nutrient deficiency, any deficiency in any regular physiological function. So, for example, if you stand up quickly and your blood pressure drops, even for a split second, you feel dizzy, lightheaded, you might even faint, you might pass out. Your brain requires a constant supply of oxygen. So when you go from sitting to standing or from lying down to standing really quickly, how amazing is it that in a nanosecond, the blood vessels in your lower body, your legs and your feet, from your hips down, all of those blood vessels constrict instantly to increase the pressure, and the blood vessels in your brain and your head from your neck up open wide, from normal to fully open wide, so that you can instantly deliver the blood that you need to keep your brain going. That happens automatically every time you stand from a sitting or a lying down position. And most of the time it works just fine. But if it's just a little bit behind the curve, then you can feel dizzy or even pass out and fall down. So iron is the main nutrient that you need to make hemoglobin, the part of the red blood cell that binds and carries oxygen and other nutrients throughout your body. And most people have no idea whether or not they have sufficient iron. And why is that? Because no doctor ever fully test, almost no doctors, most doctors never test routinely whether or not you have adequate iron stores in your body. If you're lucky, if you have an acute infection, if you have signs of anemia, most doctors will order a complete blood count, a CBC, that measures your red blood cell count, your hemoglobin, your hematocrit, the differential, which includes all of your white blood cells. This is the only way you can tell for sure if you have anemia, and most doctors don't routinely order that unless you have signs of anemia. So I see it all the time. People, I've gone to my annual physical. I'm pretty sure he checked everything. Let's see what he did. Nope, they didn't even do a CBC. Happens all the time. So CBC is like a $15 blood test. There's no reason doctors shouldn't do it every time, but they're always trying to cut costs. It's not their fault. It's the insurance companies. They're penalizing them for overutilizing any test, even a $15 test. It's insane the way our healthcare system is run and paid for. But never mind. It's $15 to order a CBC. It's not very expensive to do my full panel. I'll talk about that in a minute, that I order on everyone to see whether or not every part of your body is truly healthy. But iron deficiency anemia is so important because so many people have no idea that they have that, number one. But even worse, millions of women especially have been told they have iron deficiency anemia. They know that they lack sufficient iron, and they think, well, there's nothing I can do about it because I've tried it and I can't take iron. I tried taking, my doctor gave me an iron supplement to take. So somebody told me I should take this kind of iron. I tried it. It caused constipation. It caused so much upset in my gut. I just couldn't stand it. I can't take iron. Well, that's not true. Anybody can take iron. I've given iron to thousands of patients who were told that exact same thing, who had that experience. Why is that? That is because 99% of the supplements, iron supplements on the market, including the most commonly prescribed ones, if you get a prescription from your doctor, it's no different. It's ferrous sulfate. Ferrous sulfate. If you have an iron product that didn't work for you, if you bought iron from almost any store, read the label, it's going to say ferrous sulfate, because that's the cheapest form of supplemental iron. It's just chemistry, right? Iron is iron. No. Supplements are important to take in forms that your body can readily recognize, digest, and assimilate easily. And iron sulfate does not meet that description. Our bodies are designed to absorb nutrients from food. So if you eat a lot of beef and you're not bleeding, you're likely to not be deficient in iron. The main reason they make good multivitamins with and without irons because you usually don't need to supplement iron unless you're bleeding. Most men don't need to supplement iron. Some do because they might have hemorrhoids. They might have an ulcer in their stomach. They might have any other condition that even causes a little bit of bleeding over a long period of time. Then their blood tests will show up insufficient. Their hemoglobin might be low. Women, though, that are menstruating women are obviously losing blood every day. Any menstruating woman, unless they're eating massive amounts of beef or some other food with a lot of iron in it, you can Google food sources of iron. There are other ones. But most menstruating women never get enough iron in their diet to restore the iron that's lost through normal menstruation every day. And so many women feel miserable because no one tells them, no one diagnoses how much or whether they need to supplement iron, and they're never told that there are forms that do not cause constipation or any gastric upset. The main form that works for all 99% of people is called bisglycinate, bisglycinate. The bisglycinate form of iron does not cause any of the problems, does not cause stomach upset, does not cause constipation, and it's very easy to restore normal iron levels by just taking bisglycinate form of iron. The one I use is called reacted iron from Ortho Molecular Products. There are other ones. In severe cases, if someone is super low, then there is a time and a place for getting IV iron, injection and infusion of iron, just to refill your storage tank. And this is the part that I've been building up to. The main test that almost no doctors ever check, the only way you can truly know if you have iron deficiency and iron overload, but we're talking about deficiency today, is ferritin. Ferritin is a blood test, very common blood test, but most doctors never order it routinely. That is the storage tank. Your body stores up iron. Between meals, you always have a little bit of iron stored mainly in your liver, a few other parts of your body, in the form of ferritin. And if your ferritin is low, even if your red blood cell count is normal, your hemoglobin is normal. If your ferritin is low, that means your bone marrow is struggling, just barely able to keep cranking out enough oxygen-carrying cells in your body, but it's struggling to do so because your storage tank is low or empty. So get that ferritin tested if you really want to know. And of course, I test this on everyone, because typically every month I'll find 2 or 3 or 4 people who have iron deficiency anemia or iron overload. So some people have fewer, but some people have too much iron in their bodies as well. And that's not good either. Too much iron stored up in your body puts stress on your liver, stress on your heart, some of your other organs and tissues. The upper limit of normal for women is usually about 150, and for men, 200 or 300, depending on the lab. I had a patient that came in a couple of weeks ago a woman whose iron was 3,200 and something. That is 20 times the upper limit of normal, and it takes years to build up that much iron stored in your body. The only symptom she had was fatigue, and she wanted to be proactive and get tested. She'd had blood work done by her general practitioner a few months before that. He had no idea. He didn't test that. So she's going to have a special type of treatment where they do a series of blood draws, which means she has to ask her general practitioner to refer her to a hematologist. A hematologist is what does this special type of blood draw to get that high of level of iron back down to normal. So fortunately, we've caught it in time to get that under control, and she'll be just fine. Who do you know who doesn't have the energy that they feel like they should have, who maybe 2 years ago, 5 years ago felt amazing, and they're still doing the same things they've always been doing? Nothing's really changed except you wake up exhausted in the morning or at the end of the day after not even exerting yourself that much. Who do you know that just doesn't feel like themselves anymore? Most of the time when people are in a situation like this, they're looking for the one thing. Just tell me that one thing that's missing. Do I need drugs if I have to? Maybe it's really bad. I'd rather do it. Most people would rather do some kind of natural solution, improve their diet, maybe do some different exercise, maybe take some research-based supplements. It's never one thing is the takeaway. We need to do proper testing to identify any number of, among other things, these 12 most commonly overlooked causes of fatigue that I've been talking about in these last few episodes. And so if you missed those, you can listen to the past episodes of this show anytime you like by going to my website, binkleyhealingcenter.com. You can also email me your questions, Dr. Binkley at binkleyhealingcenter.com. You can text me at 805-218-3939. Text me anytime you like. The ringer on that phone is always off, so if you want to talk on the phone, please text me or email me and say you'd like to talk to me on the phone, and I'll call you back. My cell phone is 805-218-3939. On my website are all the past episodes of this show, so they air every Friday and Saturday, and then as soon as I can, after that, I post those episodes to what's called an RSS feed that pushes those podcasts out to Spotify, Apple Podcasts, YouTube, wherever you get your podcasts. You should be able to find it by searching my name, Dr. Binkley, and the title of the show, Safe, Effective, Natural Solutions. So you can subscribe to the show. I'd love it if you would subscribe to my show if you like it on Apple Podcasts, the little purple app that comes with every iPhone or every iPad or Mac. You can go on that app and look for Safe, Effective, Natural Solutions, Dr. Binkley, my name, and you can subscribe to that show, so it'll just appear in your podcast app every week when it comes out, and you could go scroll to the bottom, and if you enjoy the show, please like it and subscribe to it. Same thing on Spotify. On YouTube, it's a little bit different, but all the episodes end up there as well. And it's mostly just audio on YouTube, but there are a few videos as well. So I do these live talks every month, first Wednesday of the month. I do a live presentation where you can come, get your questions answered. We do a 30-minute presentation, generally some light refreshments, and a Q&A, questions and answers afterward for however many questions you have. We'll get them answered. I love meeting you and your loved ones. Feel free to bring anyone you like. Just RSVP to 805-612-5531, 805-612-5531 to RSVP for the live talk every first Wednesday of the month. The next one coming up is May 6th on, you guessed it, fatigue. So May 6th, the first Wednesday of May, 6 p.m. We'll be talking live in my office, live at Binkley Healing Center, all about fatigue and the various overlooked causes, why so many people have fatigue for no reason that anybody's been able to explain to them. I'll explain to you how there are, among other things, 12 commonly overlooked causes that are relatively easy to identify with proper testing. You can also find out more information about fatigue on a website I set up just for this purpose called FatigueFreeLiving.com, FatigueFreeLiving.com, where I delineate, describe the 12 most commonly overlooked causes of fatigue. We've gone through several of them so far in the most recent episodes of this show. We talked about insufficient protein, the basic building block for all your tissues, chronic gut infections, hypothyroidism, prediabetes, dehydration, and today iron deficiency anemia. So we're going to get into 6 more in the ensuing episodes next week and the following weeks. Folate and B12 deficiency is a major cause of anemia that is mostly underdiagnosed, if at all. Vitamin D deficiency causes fatigue in a whole host of ways. Coenzyme Q10, the most important enzyme for healing and rebuilding and repairing muscles, including your heart muscle, but muscles throughout your body, as well as the mitochondria, the furnace of every cell. Commonly overlooked cause of fatigue. Hydrochloric acid deficiency. Hydrochloric acid in your stomach is essential for absorbing protein, B vitamins, iron, magnesium, calcium, a whole host of other nutrients. So anyone you know, who do you know who's taking antacids, who's taking Tums, Prilosec, Prevacid, omeprazole, any of these acid-blocking drugs are designed to reduce hydrochloric acid in your stomach. And so they're blocking your ability to absorb protein, iron, magnesium, calcium. That acid is also your first line of defense against any kind of a bug that may get past that acid in your stomach and cause a gut infection. It cause dysbiosis in your gut, screw up your microbiome. Side effects of medication is a common cause of fatigue, and vascular inflammation in your blood vessels, creating havoc throughout your body. So we'll go over those in detail in ensuing episodes. As always, I appreciate you tuning in. Please tell your friends and family, loved ones to tune into the show every Friday at 2 o'clock, Saturdays at 3:30. Please send me your questions. Email me at drbinkley@binkleyhealingcenter.com. Text me at 805-218-3939. I look forward to hearing from you and having another opportunity to provide you with useful information you can use to take better care of your own health so that you can live long and live well. Thanks for tuning in. Have a fabulous weekend.
Tune in every Friday at 2 p.m. and Saturdays at 3:30 p.m. for safe, effective, natural solutions right here on 98.3 FM, The Word.